Well, we report on the horror stories of medical mistakes. Nearly 100,000 people die each year in our country because of them.
Tonight, we get to report on a new solution. Dennis Doda shows us how the Mayo Clinic is the first facility in Minnesota to bring safer surgeries into the operating room.
And I saw him for a cervical spine.
In the operating room these days, it's become routine to check, double-check, and triple-check.
These are his images. His MRI is on the screen over there. I checked the name.
There is even a pause for the cause as the entire surgical team stops to confirm what, where, and upon whom a procedure is going to be performed. Still, medical errors happen.
And what we found was in about 1 in 5,000 operations, there is some type of retained object.
Retained inside the patient, where they can cause life-threatening complications like infection, even decades later. Most commonly left behind are surgical sponges, those sterile cloths used to absorb blood and fluids.
A minor procedure can be just maybe 5 or 10, but for a big cardiac procedure, orthopedic procedure of the back, you can look up to upward 200, 250, 300 sponges.
Surgeon Robert Sema says now imagine keeping count of each and every sponge going in and coming out while lab reports are coming in, blood is being delivered, or the nursing team has a shift change.
Dr. Sema says when they examine cases of a sponge left behind in a Mayo Clinic procedure, the count was still right 70% of the time. Apparently, they had hit what he calls the human performance barrier.
We just couldn't get any better without something new.
The something better is technology. The first week of February, all 100 of Mayo Clinic's operating and procedure rooms started using sponges with barcodes. Each one has a data tag with a unique number woven into the fabric. It's an FDA-approved computer tracking system by Surgicount Medical.
Press scan here to scan my ID badge.
The system keeps track of who did the scanning.
Scanner to get the patient ID band.
10.
It records a master tag for each bundle as they're put into service.
1, 2, 3, 4, 5.
And accounts for each used sponge before it's discarded, greatly reducing the chance of leaving any behind.
Duplicate.
It won't let me double count a sponge, which is...
Surgical nurse and safety team member Jack Clark says it does not replace manual sponge counts, but adds a whole new level of accuracy.
The machine never gets tired, never gets distracted, and it's there to reinforce our counting techniques.
Mayo's safety team says barcodes on sponges are just the beginning. Before long, many instruments may carry barcodes. Allergies, medications, and test results may all be integrated into the same tracking system.
And Dr. Sema told Dennis many people are not aware how easily the soggy sponges can shrink and become camouflaged in the surgical site. He says Mayo helped Surgicount Medical refine their system for 2 years before adopting it in the OR.